One of the many difficulties about this COVID-19 virus is tracking down an effective means of protection. As we move back into social integration, here are some things you can do. Hello, I'm Dr. Michael Alter. This virus is new, and many well-meaning people, including myself, are doing their very best to present valid and helpful action steps you can take to protect yourself and your loved ones. With all of the effort and attention to this problem, there is understandably a very great amount of information that continues to flood the internet and research journals. There is also a tremendous amount of conflicting data, making knowing what to do very confusing. I want to say right up front that everything I am presenting to you is based on current understanding. I am making suggestions and discussing theories more often than proven facts. That's just where we are with this situation. As I see it, we have two primary choices. We can sit back and do nothing and hope for the best. Or we can do those safe things that research and clinical observation indicate may help, and take action to protect ourselves and our loved ones. Many of you have already taken advantage of the recommendations our functional medicine department has been making, and fortunately, these recommendations still hold true. But I have made some updates. As we move further along in this pandemic and more clinical information is revealed, we can begin to see more clearly what is working. I have continued to wade through mounds of data and information to bring you credible guidance for you to follow and quality products for you to use. The clinical observations I'm presenting to you represent what I feel is a consensus of what seems to be credible ways to protect against the COVID-19 virus as society starts to phase back into more social interactions. So first, what seems to be working? Let's start with our original recommendations on how to limit the replication of the virus once it enters your body. Studies such as these outline a mechanism of viral replication that may be reduced by limiting the amount of certain enzymes the virus needs to replicate. I talk about this more in the COVID-19 action plan video. Please check it out for more details. If you have been following along, you know that we have made this product available from the beginning in our Virex arsenal of products. It appears in both the bodyguard and rescue kits. Another mechanism that shows promise in reducing the rate of virus replication is the introduction of zinc into the cell. The trick here is that all zinc sources are not created equal, and zinc needs a transport mechanism to get into the cell. In other words, simply taking zinc is not good enough. You must also provide something called a zinc ionophore as the transport mechanism. We have updated our Virex arsenal with highly bioavailable forms of zinc and natural substances that act as effective zinc ionophores. Vitamin C has been getting more and more visibility for its apparent ability to limit the duration and severity of the COVID-19 infection. In hospitals, high doses of intravenous vitamin C have been introduced to get these effects. Taking oral vitamin C in pill form has not been shown to have as great an effect. However, taking high doses of capsule form vitamin C is not only less effective than liposomal vitamin C, doses in excess of 2,000 milligrams increase the risk of GI distress like diarrhea, and in some people, it may increase the risk of kidney stones. These issues are generally avoided in the liposomal and IV forms of vitamin C. Again, we have included an excellent form of liposomal vitamin C in our Virex arsenal of products. I believe that most people will be exposed to this virus in the coming months. I encourage you to equip yourself with these products. For myself and my family, we used the combination of products found in the Virex Bodyguard kit. We use this combination daily with the intent of avoiding the more serious consequences of contracting the virus. The idea is that if we can stay ahead of the virus replication and supporting the immune system, we are aiming to be in that 80% plus of people that only have mild to moderate symptoms when infected. If symptoms do develop, then we would shift the dose of products recommended to the Virex rescue protocol, and then customize it with the appropriate product available in the Virex arsenal, cough or sore throat or whatever it may be. In addition to the Virex fortification, we must do those things we know give our bodies the best fighting chance to be healthy. Get enough quality sleep. Exercise daily, preferably doing something you enjoy. Stress reduction. Do it through prayer or meditation. Avoid exposure to pathogens and practice consistent, good hygiene habits. Don't touch your face. Last, but certainly not least, maintain great gut health. Your gut can be loosely defined as everything that contributes to the tube connecting from your mouth to your ear end. These tissues must be working well for optimum immune function, neurotransmitter formation, the things that make your brain work and your emotions go, and inflammatory regulation. The studies and evidence for that statement are easy to find, and I encourage you to search them out and review them for yourself. I believe it is here in the gut where more undiscovered pre-existing conditions hide, issues that may place individuals in a higher risk category for some of the more negative consequences of COVID-19 and illness response in general. Certified functional medicine providers are trained to look for these stealthy conditions. If you wish to know the status of your gut health and how it may be impacting your immune system, then a thorough functional medicine examination is what you need. We do not yet know the extent of immunity that may be provided by exposure to the virus, or even the amount of immunity we'll get from a future vaccine. What we do know is that regardless of those things, keeping the body functioning optimally is in everyone's best interest. In the next several months, use the Virex Bodyguard Kit to fortify yourself internally. Remember, additional customizable help is available from us in the Virex arsenal products. I will continue to review and refine this arsenal as more credible information proves itself worthy of sharing. As you leave your isolation, know that you have some good knowledge and tools at your disposal to help keep you safe. I'm Dr. Michael Alter, your healthcare detective, wishing you good health.